All right. Hello, everyone. My name is Christina Becker, and I'm a director at the American Public Human Services Association. And if you're not familiar with us, APHSA is the bipartisan national membership association that represents state and local health and human services agencies and the subject matter experts that help execute their mission to improve outcomes for people nationwide. So thank you for joining us to learn more about the repatriation process and lessons learned from the evacuation efforts from Afghanistan in 2021. We're going to hear an overview of the repatriation process overseen at the federal level by the Administration of Children and Families and administered by state, human services, and emergency management agencies. We'll also hear additional information on those repatriated this year and their ongoing service needs. And we'll close with reflections from a key leader from the Virginia Department of Social Services on her experiences overseeing a repatriation effort of this scale and complexity. So today you'll hear from Lieutenant Johanna Paillet-Growl. She works at the Administration for Children and Families at the Office of Human Services Emergency Preparedness Response, so OHSEPR. She coordinates and monitors a grant concerning the U.S. repatriation program. She consults and provides guidance with case management activities to ensure appropriate service provision. She also focuses on emergency response and carries a number of other job duties. And then Fran Inge serves as Division Director at the Community and Volunteer Services Organization at the Virginia Department of Social Services. I don't know if I got that all right, Fran. I'm sorry if I didn't. And her current position involves the implementation of multiple programs and projects with both public and private community partners. So with that, I'm going to hand it over to Johanna for an overview.
So much, Christina. I'll pull up my slide. Okay, great. Good afternoon, everyone. My name is Lieutenant Paillet-Growl. I am the repatriation specialist in the Office of Human Services, Emergency Preparedness and Response, OHSEPR. OHSEPR sits within the Administration for Children and Families, ACF, and ACF is part of the U.S. Department of Health and Human Services. So today I will provide an overview of the emergency repatriation efforts during Operation Allies Welcome and discuss repatriates' transition to the routine repatriation and ongoing case management. Great. So on August 15, 2021, the emergency repatriation efforts, the National Emergency Repatriation Framework was activated. So our office activated its grantee, our grantee ISS USA, to support eligible repatriates with temporary assistance at their final destination. Both Virginia and Pennsylvania were identified as port of entry to receive American citizens and their dependents. The emergency repatriation operation lasted until September 10, 2021. So in terms of the evacuees, we had a mixed population evacuated from Afghanistan. On the left here, you can see groups who were evacuated, U.S. citizens and their immediate family members, embassy personnel and contractors, third country nationals, including lawful permanent residents, green card holders, and Afghan nationals, as well as special immigrant visa. On the right, we have the various immigration status, U.S. citizen, lawful permanent resident, special immigrant visa applicants, humanitarian parolee, Afghan at risk, and third country national. So here I wanted to share a little bit of the sequencing for evacuees. So from Afghanistan, evacuees would be sent to lily pads, which are located in third country, Germany, Spain, Italy, and other countries. And individuals would stay there temporarily before being flown out to the U.S., to the port of entry, Pennsylvania and Virginia. And from there, U.S. citizens and LPRs would then go home. Now, for CIV applicants and Afghan at risk, After arriving at the port of entry, they would then be sent to safe havens, which are military bases spread out throughout the U.S. And there they would undergo their processing related to their CIV application and be connected to additional resources. So in this slide is dated September 2021, and there's lots of data, but I thought it would be useful to take a look at this in terms of kind of a snapshot and understand the sheer number of individuals who evacuated from Afghanistan. So as of September 2021, close to 63,000 individuals had arrived at the port of entry. There were still 12,000, a little bit more than 12,000 individuals at the lily pads. And here you can see the lily pads in Germany, Spain, Italy, Qatar, UAE, Bahrain, Kuwait, and Saudi Arabia. There were also a significant number of evacuees at the safe haven. And the following slides kind of give you an idea where those safe havens are located in the U.S. So Virginia, New Mexico, Wisconsin, Texas, New Jersey, Indiana. So kind of spread out a little bit all over the country. So in terms of our program in the Emergency Repatriation Center, I wanted to provide a brief overview of the types of assistance, temporary assistance, that U.S. citizens and their dependents were provided. So they had access to cash assistance, lodging for up to 3 nights, onward travel to point of final destination. For a lot of the repatriates, Pennsylvania and Virginia were not their state of final destination, and so they needed to make their way to where they wanted to settle. They were also provided referral to state of final destination for ongoing case management, meaning that once they arrive, let's say, for example, in California, they would be connected to a state coordinator and provided with additional case management there. And while at the Emergency Repatriation Center, they were provided clothing, meals, baby items if they so needed, as well as COVID-19 vaccination if they opted in. So I wanted to provide just a brief highlight of some issues to consider with, in working with individuals who evacuated from Afghanistan. As you saw from my previous slides, a significant amount of families were at mixed status, meaning that once they arrived at the port of entry, they could be separated due to some family members needed to be processed through the safe haven, and others being able to go home. Something that really stood out to me while I was at the ERC is the worry that some of the evacuees experienced, thinking about the family members who were left behind. So thinking about that and kind of the ongoing support that they needed. A lot of parents had very young children, and they were eager to get the children back into school and were not quite sure how to navigate the system, and really wanted resources for their children and connection to resources in the state of final destination. Something to keep in mind as well is a significant amount of repatriates settled in California because they had some family members there. Perhaps they heard of resources there. However, once they arrived there, they found they were faced with significant challenges in terms of housing and being able to stay there due to the cost of housing. We have worked with expectant mothers or women who found out about their pregnancy status once they arrived in the U.S. So also providing the right resources for those expectant mothers. Again, another population to think about are widows. Also, that is another theme that came up for us in the routine repatriation space, where perhaps someone who had resided, who was a binational, had resided in the U.S., but then her husband passed, so I returned to Afghanistan and now was coming back to the US, but I've had very little connections or no connection at all back in the US. So thinking about the type of support that those individuals would need. And finally, single parents with very young children trying to think about getting employment and finding kind of the right resources also to juggle a full-time job while caring for very young children. So again, this is just kind of a broad stroke. I think the situation continues to evolve and some of the needs might have changed, but I wanted to share what we've seen in our routine repatriation program. So thank you so much for your attention. I will pass it on to Fran.
Thanks, Johanna. I appreciate that. Again, I am Fran Inge. I'm the Community and Volunteer Services Division Director at the Virginia Department of Social Services. It is in this division where refugee resettlement and repatriation resides. As Johanna has discussed, Virginia was a point of entry for a very large event at Dulles for 1 month during August and September. During that time, I lived at Dulles and learned more about repatriation than I ever wanted to know. And I would like to share some lessons Virginia learned that may help others should the need arise. The first lesson is no surprise. Planning and relationships are critical. In Virginia, we do individual repatriation on a regular basis and have great policies and processes in place. However, when it came to mass repatriation, we had a plan that was in the middle of a rewrite. Since mass repatriation is something we rarely do, we didn't have the action-ready plan nor relationships to hit the ground running. To demonstrate how flat-footed we were in the planning process, we did not have a way to provide cash assistance. We had always known we were responsible for cash assistance, but had just never invested the time to develop an action-ready process. Virginia and other states don't have a drawer of cash they draw on for cash assistance, but after many conversations with state finance staff, Virginia ended up having administrative staff run all over Richmond at midnight purchasing Visa, MasterCard gift cards that said things like Happy Birthday and Merry Christmas. We simply were not prepared, but it got done with the assistance of so many folks that never set foot in the repatriation center. Within our agency, we have one staff person who has mass repatriation as 10% of his job responsibilities. There is no dedicated funding for staffing repatriation. We had not had communication with our state or federal partners or done a training exercise since 2018. Saying that, I am not sure any plan would have prepared us for the event we experienced this summer. My entire perception of federal partnerships changed. As a state person, I hope this isn't a big shocker, but sometimes we roll our eyes and groan when federal intervention occurs. But I don't say that anymore. This event could not have occurred without the boots on the ground from hundreds, if not thousands, of federal partners. It was our federal partner, OHSEPR, that taught us our most important lesson: follow the money. The entire OHSEPR team was on the ground, and in the early days, when lines of responsibility were blurred between repatriation event, a military mission, a COVID testing event, it was our relationship with OHSEPR who brought clarity. If HHS wouldn't pay the bill, it wasn't a repatriation mission. The phrase, "not our problem," sounds harsh, but it was absolutely necessary with some of our other federal partners. Dealing with lost luggage, picking up persons who had been taken to local hospitals, finding a humane solution to have persons wait until their next flight, and other mission creep issues filled our days and nights. OHSEPR's clear understanding of the funding parameters and having OHSEPR finance staff on site saved the Commonwealth of Virginia millions of dollars. Additionally, concerning relationships, just having a person's contact information at various state and federal agencies that can help get you to the right person is the lesson that we want to make sure that we never lose. Those relationships prior to an event makes all the difference in the world. Our second lesson was around mixed immigration status families, as Johanna has mentioned. While at Dulles, US citizens trying to get home were sent to the Repatriation Center where they were assisted with their onward travel if needed. Office of Refugee Resettlement dealt with unaccompanied minors. And for the most part, persons who were SIVs or Afghan nationals were sent to a holding place near Dulles until they could be transferred to one of the military bases. LPRs, or green card holders, in the early days were bounced around all over without having anyone have the authority to provide assistance for onward travel. The problem was many of the families that entered the US during those days were mixed immigration status families. Every configuration of immigration status was seen. For example, parents were Afghan nationals, but child might be a US citizen. And that is not to mention the issue of extended family units that may have a minor cousin with them, and they all wanted to stay together. Having some kind of plan for mixed immigration status families would be one of those lessons that needs to be thought out before our next big event. I think the tipping point for Virginia was when dealing with one frustrated green card holder who had been bounced around everywhere for a couple days trying to find assistance for onward travel. He exclaimed, "Well, I guess I'm just going to be homeless in DC." That is when Virginia set up an LPR center that would help families that had a person with a green card get into their final destination. We set up the center with private funds run through the United Way of Capital Area. And while the LPR Center was only open for 4 days before the measles stopped the planes, 150 persons were served. There was clearly a need for LPR assistance. The third lesson was around volunteers and donations. As you can imagine, everyone and their brother wanted to assist the thousands of new Americans in lots of ways. Resettlement agencies, which had been pretty decimated by policies in the previous administration, did not have the organizational capacity to take advantage of all the volunteers and donations. We knew volunteers and donations for our new Americans would be most needed, but we weren't ready. They wouldn't be needed for a few months down the road. The problem was how to take advantage of the donations while it was still a hot issue and people wanted to contribute. Volunteers were desperately needed, but there wasn't a volunteer management solution in place. The communication time it took with well-meaning folks, storage spaces, people just dropping off donations, and even the quality of donations were all concerns. 3 entities were and are invaluable to problem solving this issue. The first was through emergency management functions within the Virginia Department of Emergency Management. We contacted ESF 17, who set up a temporary spreadsheet solution to catalog donation groups wanted to provide. The second was around the National 211 system for information and referral. Persons who wanted to contribute were directed to the 24/7 211 system, which gets a local, or in Virginia's case, a statewide response. Using the ESF 17 donation spreadsheet in real time, messaging and training was provided to 211 call specialists to direct persons to appropriate donation options. It was the way in Virginia we connected what people wanted to give with organizations needing donations. Since most of our new Americans came with their smartphones, we also had linguistically appropriate signs placed at the airport and repatriation center that pointed Afghans needing human services to call, text, or email 211 whenever they were in the United States. Since 211 is a national system, I hope we recognize the value of an information and referral system like 211 that can play a role in connecting people to resources. Today, I am happy to say that Team Rubicon is in the early stages of providing volunteer and donations assistance in Northern Virginia. It is another one of those items that I hope we will spend some time preparing before the next big event. The last lesson I want to talk about was around cultural competency. I have to be honest, within my agency, we used to feel that mass repatriation needed to be the responsibility of our state emergency management folks. When you look at all that might be needed to be provided to repatriates, things like mental health services, caring for animals, dealing with health issues, feeding people, and the list goes on. We always thought our existing emergency management structure would be better suited than our little Office of New Americans with its 4 and sometimes 7 staff members. I don't think that way any longer. The reason for that is cultural competency. Throughout the mass repatriation event, I saw how critical it was for the Office of New Americans to put their touch to this work. From the beginning, the Office of New Americans engaged local case managers and interpreters who work in this field every day. They understood the needs of folks differently than government bureaucrats. For example, there was a room full of both case managers and state staff. As a state staff person, I saw little boys running and playing around in the room. Local staff, however, saw little boys playing out the trauma that they had experienced on the tarmac in Kabul. Another example, state staff felt it would be great to have therapy dogs. However, local staff understood that dogs were seen as unclean in Afghanistan. There was not a state staff present that didn't have a major lesson in cultural competency during our month at Dulles. In closing, I want to say that everyone connected with this event should be extremely proud of their work. In partnership, we demonstrated the very best in human services. We were inclusive and welcoming and saved countless lives along the way. We are in the final days of closing our military bases and getting our folks to resettlement agencies where people are starting their new lives. You may want to know how it's going. I can tell you, state and federal staff and local resettlement offices are working around the clock in Virginia on housing, education, community services. The money is flowing and our resettlement agencies are now connecting volunteers with donations with the needs. Who knew getting things like mattresses moved into hundreds of apartments and housing units could be so difficult? Our resettlement agencies have partnered with our local departments of social services to get benefits flowing easier. Faith groups are stepping up to provide support to families. Employers are contacting resettlement agencies about the opportunities our Afghan population may be able to provide in a troubled employment sectors. New models for service delivery, new community partnerships, and increased resettlement capacity is occurring. Bottom line, there has been a lot of creative problem solving and hard work done, but the upside is it is producing culturally richer communities in Virginia. Personally, while it may have been the most challenging assignment of my career, I am proud to have been connected with this repatriation event. And now I'll turn it back over to Christina to close us out.
All right, awesome. Well, thank you both so much for your time and for those very real and incredible insights. I know that it's going to be really helpful to a lot of jurisdictions across the country, so really thank you. And for everyone in the audience who's made it this far into the recording, thank you as well. Thank you for your time. And if you have any follow-up questions or comments, please don't hesitate to reach out to APHSA or OHSEPR. So thank you all again.